And we just did a relationship, talking about all the things
we
earlier.
didn't just do the relationship.
Briefing you, and definitely.
We didn't just do the relationship.
Right, definitely.
Looks like the relationship today will be me and you.
Okay, definitely.
Yeah, we're yet to do the relationship.
Right. And we just gave you an update of the coronavirus and looking at all the numbers and related issues. But in the meantime, we have to get more updates. And we do have Olumayowa Tijani with the cable newspaper base in the capital, Lagos, as well. Also, we've had the first case reported. And good morning to you, Mr. Tijani.
Good morning.
And yeah, the first question I would want to ask you, how is the media reporting this in the first place, in and around Nigeria, so to speak?
I think that the media has, like every part of Nigeria, has been prepared for a time like this. So everybody's trying to be as responsible as possible in the sort of reporting that we are having at this point in time. So for now, most of the reporting we've seen has been very responsible in nature, and of course offering as much help as possible to the reading public.
What was the how did they communicate the news in the first place beyond just the press release?
Okay, okay. So before now, for most of the cases, most of the persons returning from countries affected by the coronavirus disease have had to undergo some sort of screening. So as at yesterday, the Center for Disease and Control, Nigerian Center for Disease Control, had tested 11 people, and all of them turned out negative. So we've been following the news. They've been giving us information updates on every particular case that they checked out. And so when this happened, in fact, the press release came out at about midnight. And when that came out, we were in a situation where we had reported consistently on how there have been tests and tests and tests, and of course we've not found anything up until now. There's been reporting from the airport, from places that we consider a little bit vulnerable at this time. So it's just the press release and of course some level of relief, some level of, okay, if you find anybody in this particular situation, this is how to get help and all that.
Okay, so now we have the Center for Disease Control in that statement indicating that they had rallied all the support group following their experiences in Ebola and the crisis that it resulted in the West African country. Now, how has that been able to help in trying to spread information, and keep communication tight in relation to the first case that has now been confirmed?
Okay, so one of the lessons we learned from the Ebola virus disease was that if we work together, we can win. And so that's one thing I've been telling ourselves in the media, in relationship with civil society organizations, with the regulatory agencies, with the disease control center. So everybody has come to a space where we feel that the only way we can combat this sort of disease is by working together. So nobody is going alone at this point in time, because of course if we don't work together, we get so far in the long run together. So it's just best for every one of us to work together. And this has been the situation with the NCCC and of course with the Lagos State government. So of course, as before now, we had expected that this was going to come in through, if at all, the highest probability was going to be through the Murtala Airport, which of course has the largest traffic from regions affected by this disease. So I feel like that preparation from the Ebola crisis has sort of helped the nation galvanize all stakeholders and saying, okay, this is what we must do at this point in time.
Now, the statement doesn't state whether the case is a Nigerian or not. All that it says is that the person works in Nigeria. Is the person an expatriate or not, or a local?
Yes, the person is an expatriate. The person is not a Nigerian. He's said to have just returned from Italy. So the Lagos State government suggested in a statement that the person is an Italian. Though we cannot say that for sure, but not likely in Nigeria.
Okay. And then also you get to find out in the reports, many of the international media kept using a Nigerian woman at an airport. So the nationality issue was also confusing. But in the first place, what are the preparations at the Nigerian airports, the Murtala airports specifically, knowing that that's the main port of entry?
Okay, so some of our reporters were at the Murtala Mohammed airport some days ago, and one of the things we found was that they had been given fresh equipment to measure temperature and a few other things for everyone arriving at the airport. There's a video released like yesterday and some pictures which was showing the whole process of screening and all that. So some level of preparation had existed. And of course, having tested 11 cases before now, it clearly shows that the agencies have been preparing one way or the other. And of course, Nigerian Ministry of Health says that about 620 million naira has been, and that's about nearly $2 million has been set apart for this sort of situation. So we've been prepared, first by the Ebola crisis, second at this point in 2020 to kind of pick this up when it comes. And so I think that's one of the things that we are enjoying now. And of course, with this first case, I'm sure that the state government is going to have to reinforce the screening methods and all that, so we don't get more than we already have.
All right. Thank you very much. With the cable newspaper based in Lagos City, we have Oluwamayowa Tijani giving us the latest update from Nigeria. First case reported and confirmed. And
yeah, it makes it all very scary because you know Nigerians are neighbors.
Yeah. I mean, literally, they're just here.
Yeah. It comes. So
we have friends who are Nigerians too.
Exactly.
So it brings the issue closer.
So you know, then we begin to ask ourselves,
what have we done?
Our preparedness again. You know, even though we've been talking about it a lot, we've been engaging the Ghana Health Service, the Ministry of Health. I went to Nogochi not too long ago to engage with the director there because that's where all the testing, you know, would take place, suspected cases. So it brings back the issue of our preparedness. And you know, one of our colleagues, PAC, also did a story about the Tema General Hospital and the fact that they don't have water running through their taps, even though that's a designated center in case of any suspected case in Accra, at least, or in the Greater Accra region. So it just brings back, are we prepared? What are we doing? That kind of thing. Yeah, so basically that. And our friends in Nigeria, they've done this before with Ebola. They handled it quite well, even though they had some casualties in the end, but they controlled it. So we're very hopeful, and we know that they have the capacity to control this situation as well. It's just, you know, we'll continue to pray and hope that it doesn't get any worse than it has gotten. Yeah.